All right, good morning, everybody, and thank you for joining us today. I'm Cheryl George, and I will be your host for today's session. One of our many missions here at Blue Cross North Carolina is focusing on care in every community. But what does that really mean? How do we work with community leaders? What areas of focus are we prioritizing right now based on insights learned from those community leaders? What is equitable healthcare, and how do we work to bring it to members across the state? All wonderful questions and all that we hope to answer this morning as we discuss how Blue Cross North Carolina works with you, our customers, and local organizations to help build healthier communities together. Before we jump into today's discussion, I want to review just a few routine housekeeping items. You may have noticed some changes to the Zoom platform from the last time you were here. It looks like some updates happened recently over the last week or so. We recommend adjusting your view at the top of the screen to gallery mode for the best view if it isn't already. As I mentioned in the chat, this webinar is being recorded and will be provided to all registrants via email later this week. If you have any questions at all throughout the webinar, please utilize the Q&A feature. We do have some experts behind the scenes to help answer questions, and we will be leaving some time at the end as well. And then lastly, at the end of today's session, a survey will pop up in your browser. Your feedback on these surveys is very important for the development of future webinars. Plus, by completing that survey, you will be automatically entered into a drawing to win a $25 Amazon gift card. So please keep a lookout for that. Joining me today, I have Cheryl Parquet, Director of Community Engagement here at Blue Cross North Carolina, and Donavon Boykin, Senior Program Manager, focused on drivers of health strategy. As Director of Community Engagement, Cheryl is responsible for the development and implementation of all corporate-based philanthropic initiatives, including community investments, employee volunteerism, and strategic partnerships to help improve the health and wellness of North Carolinians. Cheryl was appointed to serve on the Commission for Volunteerism and Community Service by Governor Cooper. She's an active board member for Durham Children's Initiative, Girl Scouts of Coastal Pines, North Carolina, Leadership North Carolina, Leadership Triangle, and Institute of Emerging Issues. Donavon is a senior program manager with over 8 years of experience at Blue Cross North Carolina. Starting in the provider space, he has a deep understanding of the complexities involved in healthcare and operational processes. He specialized in streamlining onboarding. He has specialized in streamlining onboarding, process improvement, and compliance and governance to ensure smooth and efficient program execution. Currently, Donavon is leading impactful drivers of health projects focused on improving outcomes through innovative solutions, advancing Blue Cross North Carolina's purpose, and adding value. Cheryl and Donavon, thank you so much for joining us here today.
Thank you.
All right, I'm wondering if we could start off a little bit with you telling us about your why. What is your personal story behind the passion that you have for the work that you're doing here at Blue Cross?
So thanks, Cheryl. I'll just say that I've been at Blue Cross for 16 years. And when I came here, really started in community. I am a native of North Carolina, born and raised in Mebane, Alamance County. So understanding what it means to grow up in a small community. My mother, me, my kids all graduated from the same high school within our town and our community. So just understanding what it means to have that close niche, but also understanding the importance of insurance. I have people in my family, like so many of you, that are probably uninsured to people that are like fully covered, and just really understanding the importance of healthcare and being an advocate. And my why for being here is to make sure that not only can I be an advocate for my family and my community, but for people across the state of North Carolina.
Yeah, Cheryl, a lot of what resonates for you stands true for me as well. I'm also a native North Carolinian. I am from Clinton, which is in Sampson County. I grew up with Blue Cross being a vital tool that my parents used to care for our family. When I started my career, I knew I either wanted to work in tech or healthcare, and Blue Cross really represents a really unique intersection of both. As a Drivers of Health team member, Cheryl G., when you introduced me, you talked about those innovative solutions. And then our company supports our state, we give back, and then we have that member first approach.
That's wonderful to hear. I appreciate both of you for sharing that. Before we get into today's discussion, I actually want to kick things off with a little poll question. For those of you here in North Carolina, how many of our 100 counties have you visited? There should be a poll that pops up right there for you. And it looks like we have a few answers coming in. And it looks like for the most part, people are in that right sweet spot right in the middle, about 10 to 25. It does look like we have one that is we have a couple that are 50 plus. I'm wondering if Tunde happens to be here on the call with us today. We asked this question because we are coming on the tail end of the Extra Miles Tour. We've heard a lot of exciting things coming out of that. And I'm wondering, Cheryl, if you could tell us a little bit more about the purpose behind and the results of the Extra Miles Tour.
Absolutely. The Extra Miles Tour was an opportunity for our leaders to get out and see our state. I am a firm believer that you cannot serve the people of North Carolina without actually knowing what is happening directly on the ground around our state. And so we had the opportunity to go out to all 100 counties. We met with government officials, teachers, legislators, community leaders. A lot of our agents were there. Some of our customers were there, and really just had deep conversations. We really understood that each county is so unique. There's this saying, when you've seen one county within our state, you've seen one, just because they're so unique. But at the same time, we also understand that a lot of them deal with a lot of the same issues that we're going to talk about later today in our conversation. But the Extra Miles Tour is just, again, a great opportunity for our leaders to get out. I do want to say that Tunde went to all 100 counties. I was there with him right along for the ride, and to have our leadership to be committed to this was just as important as well, and being able to listen and bring back those key initiatives back to our company to help launch our CSR strategy.
It's wonderful. Thanks for sharing. I did want to pause and ask a quick question because I know we use a lot of acronyms here at Blue Cross, and I'm worried that some folks on the call may think that when you say CSR, we're referring to customer service reps. Could you expand on that a little bit more?
Absolutely. So when I am saying CSR, that means corporate social responsibility. Not only is our team, but is how we are also working as an organization moving forward. Blue Cross has always been committed to our community. You guys have seen it from a lot of the work that you've seen us volunteering and giving back through our investments. But CSR is so much more than that. It is how we're bringing the entire company together to work. And so you're going to see, like, through our work where we're bringing our healthcare team, we want to make changes around our policies. We want to make changes with our product, but we also want to show up in the community. And so we're bringing the full strength of our partnerships together internally to be able to really move our company forward. And so I'll let Donavon talk a little bit more about how CSR has truly expanded into the work that we're moving forward in.
Thanks, Cheryl. You all did a lot of listening. You talked about how each of your experiences in every county was unique, but there were some recurring themes that popped up throughout the tour. And so those themes are health through food, access to care, and youth behavioral health. These are going to be our priority focus areas moving forward through corporate and social responsibility, areas where we feel like we can make an immediate difference and bring about long-term change. Again, we chose those priorities based on input from the communities, and we want those initiatives to have measurable criteria for social and business impact.
That's awesome. Thanks for sharing that. So Donavon, I want to circle back to something you just mentioned. You had 3 areas of focus. I believe it was youth behavioral health, health through food, and access to care. Wondering if we could dive a little bit deeper on that, either Cheryl or Donavon, wondering if one of you would want to be able to take that.
Absolutely. How about we launch a poll question really quick? How many counties do you guys feel truly lack access from professional youth services? 35, 42, 68?
Oh, we're getting quite a few. It looks like a lot of people guessed the actual correct answer. If you want to share with the class.
Absolutely. It's 68. And if you're looking at the slide, you'll definitely see that answer is on the slide. But what I really want to talk about when we're looking at youth behavior health and why we landed on this, we heard this issue in every county that we visited, that our children were lacking connectivity, they felt hopelessness, and they were sad. And coming out of the pandemic, we really don't know what are the lasting effects that our children are going to see. And so Blue Cross really decided that we would take our flag and put it around youth behavior health and launch this initiative. I remember that when we were out in Bladen County, we actually heard from one of the ladies at DSS who was talking about how over 60% of young girls had actually considered suicide. And when you hear those stats that are happening across our state, we know that we had to respond to this issue. I do want to take some time before I go deeper into this work is to show a quick video to really show you what our leaders are doing in this space as well.
As we traveled across the state and we asked the people and communities, what can we do for you? What they consistently said was, we are worried about the mental health of our youth. We also heard about the power of mental health first aid training.
And so for us to feel like we could truly understand it, we needed to go through the training, and that's what we did today as a team.
What we're doing in there is we're bringing leaders across the state together through Blue Cross that can make a difference today, not in 10 years from now.
Stigma is such an important key in shifting culture and really engaging and encouraging help-seeking behavior.
The youth of our state are really suffering. It's hard what they're navigating. They have the pressures of just being a kid. They don't really know how to process and navigate the pandemic that we've all lived through. They're trying to figure out how to navigate social media and what that means for them as an individual, for their body images, for how they feel about themselves, how they compare themselves to their peers. It's a lot of pressure.
I'm a family physician by background, also a dad. And when you hear numbers like 1 in 5 youth in America today are experiencing a mental health challenge, that's actually incredibly scary.
We need to have the people working with our youth have basic language and understanding so that they can have conversations and be most helpful in their interactions with kids and really understand this is a problem, this is not a problem, and what then needs to be referred for further care.
It's about caring about people.
We cannot abandon them.
No one's expecting them to diagnose and treat. That has to happen with a licensed mental health professional.
Once you've gone through mental health first aid training, it's actually a lot easier than you think to be able to help someone who is experiencing a mental health challenge or in crisis.
This training gives you the tools and the ways to ask questions and think that could really save a life.
We learned a lot. We made connections. We made friends. We made commitments. This training is not the solution. What it is a great first step, the beginning.
Again, I want to say our leadership team is truly committed to this work. They've all taken the training. The training is step one. One of the things that we're doing as we think about youth behavior health is what are the interventions and what are the preventions that we can put in place with this crisis that we're experiencing? How do we get more providers trained in the space? How do we get the common person, such as you and me, engaged in a space where we can recognize the issues that are happening with our youth? So we will be providing youth mental health training, first aid training across our state. We're working with UNC. Recently, we've actually trained employees within our company who will be able to offer this training as well. So you'll have the opportunity to maybe stop by one of our retail centers in the future to be able to have training that will be available to you. We're also looking at ways to train our teens. How do we make sure our teens, we know that teens, they want to talk to someone that they feel very comfortable with, and maybe as another student in school. So we're also looking at expanding our teen-to-teen training across the state. And again, training is just one piece. It's not going to solve the issue. So as I talk about access to care being another prime focus for us moving forward, we understand that we have to figure out what is going on with our healthcare community and making sure that we have enough providers across our state. Along our tour, and we were out really looking at access, we realized that there are some counties that didn't have hospitals there. They didn't have an urgent care nearby. People in the community were driving 45 minutes to get to the nearest doctor. And so we're really looking at how do we address access? And so when we were on the Extra Miles tour, we learned a lot about our community college system. And for those that are not aware, we have what they call the Great 58. They are training people across our state. They are training nurses, medical assistants. And so we realized, how do we have partnerships with our community colleges, knowing that if people decide to go to a community college and get their education, they will more than likely stay in their community and want to give back and help their community. So as we think about access and building that workforce, really working with our community colleges, looking at our HBCUs, how are we working with them as well, historically Black universities, to make sure that we're also culturally relevant with the work that we're doing with our providers and having access. But we're also looking at ECU, their nursing programs. UNC, we know we have some of the best nursing programs across our state. How are we working with them to help build our workforce? Again, with access, we know there are several places we can go. We are very early in our access to care strategy right now, but continuing to develop that. And we'll want to reach out to you all to understand, what are you hearing in your community? How can you help us as we're learning more about access, especially rural? So again, as we have this conversation, know that we want to reach out to you all and have you all to be a part of our strategy. We realize that we can't do this work by ourselves, that it's going to take all of us. And if you've heard Tunde ever talk, he always calls it the coalition of the willing. And so Blue Cross can't do it alone, and we're not seeing that we are. We want to bring other companies with us. We want to bring our agents with us, our communities. We want to be able to have a space where we can all share openly about what's happening in our community and work on that strategy to help us move forward. And so I've mentioned a little bit about our youth behavior health and our access. And so now I want to turn it over to Donavon as he goes a little deeper in our food is health.
Thanks, Cheryl. So you may be asking, why was food a recurring topic on the listening tour? Hunger is a critical issue, with more than 1.2 million North Carolinians being food insecure. North Carolina is the 9th largest producer of agriculture in the nation, but has the 10th highest rate of food insecurity in the United States. The impacts are potentially harmful to members and very costly to Blue Cross, with 85% of all healthcare spending related to the management of diet-related chronic diseases. So with that, what are we going to do about it? There's continued research and development with functions like the Drivers of Health team, which is my team. We're going to champion the adoption of food as medicine. We're going to educate providers and members on the benefits of consuming the right amount of nutritious food. We're also going to explore new ideas. We're going to continue to innovate, develop new solutions that meet our members where they are, and we're going to just continue to persevere.
Awesome. That is amazing work. We know, Donavon, that you have been focused specifically on drivers of health. I'm wondering if you could share a little bit more about what the drivers of health are and what the strategy is behind those.
Absolutely. Let's kick things off with a poll. So which of the following are drivers of health? Income, safe and adequate housing, access to healthy foods, social connection, or all of the above?
We have some smart people here on this call. It looks like every respondent got the correct answer. Very good.
Well, I'm glad. That makes my work here a little bit easier. I'm glad you all are so well informed and know what you do about drivers of health. So we started as a research team to identify opportunities for our company to address non-clinical factors that are going to impact people's overall health and well-being. We don't call this social determinants of health, and we actually feel pretty strongly about that. If you think about it, no one is determined to have social needs. So when you leave today with all the things you take with you, please make sure that's one of the key takeaways. Using the term determinant strips people of their agency to manage their own health and well-being. Our work has continued to evolve. We started as a research and development function, and you've heard us talk a lot about corporate and social responsibility. And so now we are shifting to support the 3 initiatives that we talked about earlier. We collaborate with a number of other business areas. So as we develop pilots that we hope to transform into programs, we collaborate with marketing, we collaborate with data and analytics. And we also have a rigorous research and data-based approach for our work. So we have a health economist on our team. And again, I talked about all the collaboration just to make sure that as we are moving these things to market, we can move them to market in good faith. Mhm. This really ties into the health through food work. Um, Most of our aim is to make sure that people are eating the right kinds of food. But we want to complement the philanthropic support, some of the work that Cheryl's team is doing by addressing food and nutritional security. We also want to make sure that we are putting things, again, into the market that are making our members healthier and thus making us more profitable as a business. Um, it's important that our work on food, in addition to our other pilots, has measurable outcomes. Again, we want to support our members with that potential to reduce that cost of care. Our team is currently evaluating a number of pilots focused on the long-term strategies and really eliminating those health disparities. And by focusing on this work, we hope to not only improve the outcomes, but again, reduce those medical costs for our members and strengthen our communities and make sure that overall North Carolinians have a greater sense of well-being. With that, we're going to go into Resource Navigator. All right, so Resource Navigator is part of our larger screen and refer strategy. It's the member-facing platform. There is a internal staff tool that you can use as well, and I'll differentiate between the two. But first of all, let's dive in here. So I mentioned earlier in the presentation that I'm from Clinton, North Carolina. So for the zip code, we're going to use 28328. All right, you can see there's 2,084 programs in Clinton, North Carolina, and we're going to click on food. And so these are separated based on those drivers of health like we talked about earlier, which you all know a lot about based on those poll results. And here, based on your need, you can click and you can choose and you can see the resources that are available in your area. So this tool was really developed to empower members and connect them with resources that are available across our state. You can see, again, there's other options. So there's goods, transit, health, money, education, and legal options that you can choose from. All right, again, and that's the member-facing platform. We do have a staff-facing platform as well. And the key difference between the two tools is that Member Resource Connect, which is that staff-facing tool, is used by care managers to screen for social needs and refer them to those community-based organizations. And you can see some of the community-based organizations popping up here once you dive in deeper. And we'll provide you all with the link to this so you can kind of look and see what's available in your area and hopefully pass this information along. Now, you may be asking why these tools were developed. We found that we were behind key competitors in providing options for those drivers of health capabilities, and there was no standard social screening approach throughout the organization. Manual systems were used to connect members to resources, but we all know those are time-consuming to use and also very time-consuming to maintain. And so by investing in these capabilities through a screen and refer platform, we were better able to equip and understand and address our members' needs and increase those self-reported member data points to develop those tailored programs and meet our HEDIS reporting requirements.
Donovan, can I just say, I really love that resource navigator. I am a mom, and so in my local town, we have a Facebook group that's just like a mom group, and people can ask questions and pit things back and forth. But very often, I mean, I would say at least once a week, I see a post that comes from a mom saying that they need some baby formula or that they've run out of diapers because their child is sized up and they can't afford it, or somebody's asking if they can get a ride into the larger town next to us to access a doctor's appointment. And so I think that's just a really great tool to really help people in the community that maybe are just struggling for the moment and just need a little extra support in that area. So I think that's amazing.
And I think you hit on a really good point. There are a lot of resources out there, but those resources aren't doing anyone any good if people can't connect to them. And so it's a really great opportunity to kind of ease finding, to your point, meeting people where they are and allowing them to access what they need.
Yeah, that's wonderful. Thank you for sharing that.
Of course, of course. We have another solution called Feed Your Health Diabetes. And so we're taking a role in promoting our food as medicine efforts. We're really proud of this one. We developed it in-house. It was an evaluation that leveraged food delivery and health coaching for our members with diabetes. So to participate in the program, you had to have an A1C of 8 or higher. And we actually published the results in the New England Journal of Medicine in the Catalyst edition. We can provide you all with the link to that if you want some really great reading. But again, rather than rely on the data from a third party, we developed our own program. After evaluating the program, we used the data that we've gathered again to transition this into a program. Members had access to food delivery. They could meet with a registered dietitian and get support through a wellness associate for those members with uncontrolled type 2 diabetes with the goal of driving behavioral change. Now, that behavioral change is really important because we want members to continue with these healthy behaviors after they're no longer in the program. And we're really happy to report that as of today, more than 1,400 individual under 65, Blue Cross employee and Medicare Advantage members are enrolled in the Feed Your Health Diabetes program. So with that, I've discussed 2 of our successful programs and talked to you all a little bit about drivers of health. I'm going to hand it back to Cheryl P. to talk to us about volunteerism and giving back as part of community engagement.
Absolutely. And so when we talked about CSR earlier, I just want to make sure everyone knows, like, Blue Cross is still committed to our volunteerism. Our employees are out each and every day volunteering in our community. They're from the food bank to the diaper bank, building playgrounds. I know coming up this week, we'll actually be building our 17th playground in Rocky Mount. And again, volunteerism, I always say, it is a part of our DNA. It is a foundation of who we are at Blue Cross and Blue Shield of North Carolina. So I want to extend the invite to you all as we're working across our state, volunteering. If there are opportunities that you see, I would encourage you to reach out to us. I would also encourage you to join us at our volunteer opportunities as well. We are always looking at inviting our customers and agents out in the community to be a part of the work that we're doing. And again, even this year, as we've looked at our volunteering and really looked at our hands-on volunteering, this year we've actually taken the opportunity to expand our skills-based opportunity. And that's where our employees are working directly with our nonprofit community, giving back the skills that they use each and every day. So for nonprofits that are out there that may need help with a strategic plan or their marketing concepts, or even a database that our financial team may be able to create for them, we're actually using our employees in a very different way by showing the resources that we have. Again, pulling on all the strings when we talk about CSR from across the company and across the enterprise.
Awesome. Thank you for that. And I'm wondering, you keep mentioning CSR, and I'm wondering if there's anything during today's presentation so far that we haven't, that's very exciting. I mean, there's lots of exciting work going on with CSR, and I'm wondering if there's anything that we haven't had a chance to discuss that would be fun to share with the team.
Well, I'll share, and this can be breaking news. I know we're going to be talking about this later, but I have talked about the coalition of the willing and how we're going to work with other partners across our state. I will say we will be hosting one of our first convenings around youth behavior health and really talking about the connectivity and resiliency with our business community, our nonprofit community, and other funders, just to have a conversation on how we can all come and work together. So if anybody is interested in being a part of that conversation, please feel free to reach out to me. We would love to have you at the event that's going to be happening on October the 15th.
Wonderful. We'll have to keep a lookout for that. I have one final question before we take a look at the questions from the Q&A. I wanted to ask, how can the employers and the brokers here on this call help with all of these exciting things that we have going on?
Yeah, I'll say go ahead. I'll say, as I mentioned earlier, our youth behavior health first aid training that we are releasing, I would ask you all to connect with us. We would love to help to get you all trained to learn more about what it means to be a trainer for people that may want to be able to offer this in their community. You can also be certified to train the class as well. And our volunteerism. So please feel free to reach out to us at any time. And Donovan, you may have other.
Yeah, I've signed up for my training, so I'm looking forward to that. And I would add on to what you said, Cheryl, and I would just say, we shared a lot of information today. Just try to remember 2 or 3 key points and take those back. Also continue to learn. So CSR, corporate and social responsibility, in the grand scheme of things, is fairly new. You're going to hear a lot from us, and we're going to continue to build on these initiatives. Keeping the ear out, stay abreast of what's happening. And to reiterate what Cheryl said, when you can participate, please do.
Wonderful. All right, so I'd like to take some time now to get into some of the questions that popped up through the chat. We have a very timely one. One of the first questions was asked was, if we offer a service that is not listed on the Resource Navigator, how would we go about getting it listed on the site?
Sure, that's great. Whenever you have a tool like this, there's the task of keeping it updated. We do our best to keep it updated with community-based organizations that are offering some of the services that were shown to members. But if there's anything missing, we can provide an email address and some information as far as how you would submit it to get it updated. So I'm happy to follow up with whoever asked that question so that they can help and partner with us to make sure that we're getting that information to our members.
All right, and if they're unable to reach out to you directly, can they get in touch with you through their Blue Cross North Carolina rep or
Yeah,
representative?
absolutely.
Okay.
Absolutely.
Perfect. That's a great takeaway. This is a question that popped up from the registration, and I think we touched on it just a little bit during the actual presentation, Cheryl, but I'm wondering if you could speak to some of our partnerships with nonprofits, if we have them, which we do, and what those relationships tend to look like.
Yeah, so I'll say our partnerships with nonprofit really varies, right? So I will say, if you look at the scheme of what we're supporting, we have our corporate citizenship partners, and that falls along with our chambers and different organizations that we want to support. But our other partners will fall in those 3 focus areas that we talked about before. So we're really going in and looking at our youth behavior health, access, and our food. So again, we partner with the food banks, the food hubs across our state. We also partner with a lot of our university partners as well that's doing this work, but a lot of grassroots organizations as well. And so we have our information on our website on how you can engage with us to find out more and to send that information over to us. I also want to mention too that we have a county engagement team. So it's anywhere from about 12 to 15 employees that are really serving our state. And so they are on the ground each and every day, making contacts directly. And so if you want to contact one of them, they're also able to get that information to us as well, if you are a smaller organization that is doing work. But they are really our boots on the ground that is letting us know what is happening in our communities. And I'll give you an example. Just last week when the storms came through, we were on the ground working directly with them to understand what was the need locally. And so by them working with us and coming back to us, we're able to go in and look at investments that we can make directly in those communities, and also working with the American Red Cross to be able to inform them about things that are happening that they may not be aware of locally in the community as well.
Wonderful. Thank you for sharing that. Donovan, question for you. On a previous slide, we shared on a slide that we previously shared, we state that food is medicine. Could you expand on that a little bit more? What we mean by that, by calling it medicine?
Absolutely. So lots of times whenever you talk about food in this space, people think you're really just focused on food or nutritional insecurity. And so food insecurity is when someone doesn't have enough to eat, and nutritional insecurity is when a person is not eating enough of the right things, so they might have some sort of deficiency, so to speak. When we talk about food as medicine, we're trying to make sure people have enough to eat and make sure people are eating the right things, in hopes that we're, for example, lowering someone's A1C if they have diabetes, or, easing hypertension. So we are really using it, as the name implies, to treat something. And that's so important. You heard me talk earlier in the presentation about the medical expense and how expensive it is to treat some of the top ailments within our company. And so if we can do it with something as simple as food, then I think that's worth exploring.
I agree. I think that's a great way of looking at it.
Yeah.
And then one question that came up, and I'm wondering if you could talk a little bit through this. So you mentioned the initiative Health Through Food, and then we also talk about our diabetes program, which is Feed Your Health. Wondering if you could sort of detail how those two things differ from each other.
Yeah, absolutely. So we've talked about CSR, and we talked about those kind of three pillars, or those three initiatives moving forward, with Health Through Food being one of them. The Feed Your Health program, I should say, is really going to be a supporting initiative for the overall health through food. And so we've done a lot of great work in the food space. And as CSR moves forward, we're going to make sure we continue doing things that we've done well all along. And I think that Feed Your Health is a good example of something that started as a pilot, was proven effective, is now a program, and will support our health through food efforts moving forward.
Wonderful. We do have a few questions that came in through the Q&A about if we were going to be providing this presentation or this recording. The answer to both of those is yes. We'll provide this directly to all registrants via email at the end of this week. If you are curious about where to go for more information, we do have a slide here that details all of the information that we have that you could detail. And these are linked as well, so you'll get a copy of this with direct links, and then of course we'll type it out for you in the email. We have the resource navigator that Donavon mentioned earlier, where folks can type in their zip code and locate free or reduced services in their surrounding areas regarding food, housing, transportation, and many more. We also have our community and diversity engagement page, which details a lot of the exciting work that we're doing, including our initiatives, updates from our blogs, things like that, if you're curious about what else we have going on. And then lastly, we have the Extra Miles report. And that takes a deeper dive into the background of the Extra Miles tour that we detailed earlier, the communities that we visited, insights we gained, all sorts of things. And so those are just three great resources that you can start off with to learn more about. And of course, if you have any questions at all, your Blue Cross North Carolina representative will be more than happy to help you. That is all the time that we have for today. So I want to thank everybody again for joining us. Please keep a lookout for that post-webinar survey for a chance to win that Amazon gift card. We are still finalizing details for our next solution spotlight on the pharmacy landscape and the value of integration, but I will go ahead and drop that link in the chat for you to register now, so you can go ahead and put a calendar hold. If there's any changes to that, you'll be notified with an update from Zoom. Cheryl and Donavon, I want to thank you again. It was a pleasure having you here today. I hope everyone has a great rest of your day, and we look forward to seeing you again. Thanks all.